This is The Weekly on ClickOrlando.com with Justin Warmoth.
Good morning, I'm Justin Warmoth. As you've heard by now, a new variant of the coronavirus is being watched closely by health experts. The Omicron variant was first reported in South Africa, and it's still so new, there's very little data on how quickly it spreads or if existing vaccines give us protection against it. This morning, Seminole County Medical Director Dr. Todd Husty will help us better understand this new variant and how we should navigate the holiday season. What's your level of concern based on what you know so far? What's your level of concern with this variant?
So my level of concern is up there. It's because of what the experts have been looking at and finding, the over 50 mutations, 26 on the spike proteins. The spike proteins are where it attaches to us, and it sort of dictates how well it attaches and gets into our cells and then starts replicating. And all the indications are that this thing may overshadow Delta.
You know, we had a bad bout with Delta over the summer, but others not so much, because there have been a few others that have kind of been a problem in the UK and other parts of the world. Why do you think, other than the spike protein count and the stuff that we know about this variant so far, this is a variant of concern? That's why so much emphasis is being put on it, and that's why it's being treated differently.
So exactly, that's the point, is that this is, well, let's compare it to Delta. Delta, started off primarily in India, but just overran India, and we couldn't contain it. I mean, as a world, it's hard to contain viruses into one location. It doesn't really matter how much you try to decrease travel. It's sneakier than that. I mean, it gets into people. It's insidious. It's just going to find its way across borders, which we've already found with Omicron. So the Delta, though, it was so communicable. It was in such higher viral loads that it got across borders, it got across people, and it suddenly took over from all the other viruses, the other COVID-19 viruses. They compete for hosts. And this Delta was so competitive that it just took over. Well, Omicron appears to be at least as competitive as Delta, if not more so. So what's coming? What's coming is another surge.
Yeah, and the best way to protect yourself is to get vaccinated, to get those booster shots, which we'll talk about. But I'm trying to figure out the timing here, because and I know I don't know if it's apples to oranges, but it's tough to compare the different variants. But Delta was first reported in India in October of 2020, but it didn't affect us here in the state of Florida until the summer. That's some 8 months or so later. Do you expect something similar as far as the timing of this, or is that hard to predict?
It is hard to predict, although, it's a virus. They're not really smart. They just compete and they get into people. And so you can draw conclusions from past performance, if you will. And it's going to take a while. I was on a call internationally yesterday, and the expert virologist said it is too early to tell exactly what's going on with Omicron, because it takes a while. We know it took a while with Delta to try to really figure out just how bad was it. But I doubt that it's going to take us 8 months to figure out Omicron, as to whether it gets onto our shores. It's actually a little easier to identify than Delta was. You don't need a separate test. You can use current PCR testing. So we're going to be able to identify it a little bit earlier. All that said is that, yeah, there's going to be a lag period between now and when we find out just how dangerous it is, how many hospitalizations, how many deaths, that kind of thing, and whether or not it really takes over from Delta. And also, is it evading our immune systems? The immunity that we have from vaccine or previous illness. Then we're not sure of all those things. There's obviously a ton of surveillance out there. We will have data on this as soon as data it starts popping up. We will be sharing data across the world.
I know it's a wait and see approach, but as we do start to learn more about this, what would you be watching out for in particular that might cause you some concern?
Well, the any any COVID that has mutated that is taking over because it's more infectious than a previous. I mean, that right there is cause for concern. But then probably the real biggie is, does this thing evade our current immunity from vaccine or previous illness? I mean, that's the game changer. That's what we've been afraid of. That's why we wanted to hit herd immunity so that the virus wouldn't have as much chance to mutate. We could nip it before it mutates out of control. And if it evades our immunity, it's out of control again. It's like pressing the reset button. We've got to start all over. That's a horrible thought.
Yeah, I don't want to go there at this point. But I do want to talk about the science behind it because, Africa as a nation, I believe it's about a quarter of the people are vaccinated. That's it, about 25%. And that's how viruses mutate from person to person, what have you. Can you talk a little bit more about that? And, a lot of people are saying, well, hey, listen, nothing mutates over here. What's the deal with that? How come it always mutates in another country? But there's science behind it.
So mutations just happen every time an organism replicates itself. And we know that most mutations are not good for the organism. They don't help it, but it's all just chance. It's all like a Las Vegas thing. It's all about probability. If it mutates often enough, sooner or later, one of those sets of mutations will actually help the virus get into people better than the virus before. And so it's all about probability. It's not about smart. It's not smart. It's just mutating. And most of those are not helpful for the virus, but some of them are. And does it happen here in the United States? Well, sure, it would happen here in the United States too. In fact, there have probably been mutations. They just weren't as prolific. They weren't as strong. They didn't get from person to person more. It just so happens that Delta was that strong, and that's why it took over. It's just a chance. It's probability. It's not something to go, oh, well, that only happens in other countries. No, it happens whenever the virus is replicating. It's also mutating.
Thousands of mutations have happened from the original, right? I mean, that's the thing is like we have spoken probably about a few. I mean, I don't know, 3 or 4 handful. Delta, of course, being the most dominant to this point, but thousands of mutations have happened.
Oh, maybe millions.
Maybe millions.
I mean,
right.
Yeah, it mutations happen. Yeah. You don't see mutations as much in organisms that don't replicate as often. I mean, how often do humans replicate? I don't know, 3 times. I've got 3 kids. I mean, but these things are replicating like millions of times in each individual. I mean, think about the chance that it's going to mutate. It's going to mutate a certain percentage of those times. And you do that with millions of people across the world. I mean, this thing probably has had mutation, maybe 1 billion mutations, but only some of them really affect the way that it transmits and how severe it is, and whether and how our immunity that we built against spike proteins primarily, if they change the spike protein enough, we don't have immunity anymore. That's the scary stuff.
And the best way to protect yourself against the virus is, of course, getting vaccinated. Coming up, Dr. Husty will give us an update on where things stand numbers-wise and why you should get your booster if you're eligible. Stay with us.
This is The Weekly on ClickOrlando.com with Justin Warmoth.
Welcome back as we continue our discussion about the coronavirus and the new Omicron variant, something the CDC calls a variant of concern. That same classification was used for the Delta variant, which now makes up 99% of cases in the United States. Here's part 2 of my interview with Seminole County Medical Director, Dr. Todd Husty.
I mean, what would you recommend people do other than get vaccinated? Because that is certainly the best way to protect yourself. But when it comes to social distancing, mask wearing, I mean, do we continue to do that? What other precautions would you recommend?
So, whenever I speak, I have to point out that I was on a statewide, national, international call yesterday, and so Todd Husty I'm smart because I listen to smart people, and and they're saying sort of what I felt we were going to say, which is, you know what, this pandemic is not over in the world. It's not over in the United States. I mean, if you look at certain pockets of the United States, they're still having a hard time with Delta. We've done pretty well, but that doesn't mean that as our immunity wanes, my immunity at 6.5 months after my second dose of Moderna, my immunity was gone. And so I got my booster and it's all back again. But that's for the current existing viruses, and we don't know about Omicron. So what am I going to do? I mean, just personally. So when I went to the hardware stores a couple times over this past weekend, and I went, God, I'm going to look like a dork, but I'm going to wear my mask, because I don't know if I have it. I don't know who might have something new. And I think I just have to bite the bullet and say, you know what, I'm fully vaccinated, but you can still get this. We don't know exactly what's going on. I also turned 70 last week. And at 70, I don't want this stuff. I mean, I can't afford to play with it. And but also as a community member, I know that if I wear a good mask, I protect myself and N95, but I also protect everybody else. And I think if Omicron turns out to be what it is, it might be that eye-opening reawakening that this pandemic is not over. I mean, we're over it, but it's not over with us. And I've used that line many times, and I saw that in national news, other people using the same line. I don't know who started it, but it's very true. We are over the pandemic, but it's not over with us.
COVID fatigue, to your point, people have it. I'm sure you have it. I have it. I'm done with it. Everyone's over it. But to your point, the pandemic's not over us. How do you combat that? How do you basically turn your brain on again and be like, okay, this is still a thing? Is there something that you do to kind of remind yourself, hey, this is still a thing? We have to protect ourselves, protect others.
Well, I'm probably a little different than the general public because every day I read everything I can on COVID. So I'm getting blasted by data and information. I try to filter it so that I'm not going extreme with it. I'm trying to, make sure that we're taking the middle road. So I don't really have to remind myself. I do think that, and I remember that when Delta first started hitting us bad, we had a reawakening on vaccinations. We had a lot more people wanting to get vaccinated. And I think Omicron is probably going to do that to us because it's more than likely it's a variant of interest. Well, it's a variant of interest because it's scary.
I'm curious, just based on what the numbers that you're seeing, are people who are due for their boosters, are they going?
Many are. There are a lot of people are going, so why should I get a booster? Do I really need one? There's not very much in Central Florida, etc. That attitude is going to hurt us eventually, because that means that the pool of people who could get it, that with waning immunity, which we know happens now, it's not a question of is it going to happen to everybody? Yes, they're going to have waning immunity. The pool of people it can get into gets bigger and bigger. And when that happens, we're farther and farther from herd immunity. We have no community protection at that point, and the community can get nailed. So yeah, it's, but you almost have to explain that to people, and they go, oh, well, I've been sort of riding the fence about getting my booster. No, we probably shouldn't ride the fence about getting a booster. We just need to do it.
What are you saying when it comes to vaccinations for kids?
So again, I follow my experts, and I know a number of pediatric immunology experts. I've learned to get to know them over time. And I know one that works here in Central Florida said, my kids will be first in line. I mean, they're very safe vaccines. We believe it or not, despite what everybody's heard, they are some of the safest vaccines we've ever made. Are there side effects? Sure. Do we think there's long-term side effects? Very little. But what about getting COVID? Even kids can get bad COVID. I mean, not as often, but they can. So you talk to a pediatric immunologist and they'll go safe cure, safe prevention, not necessarily cure, but safe prevention, and bad disease, possible bad disease. I'm going to get my kid protected. Mm-hmm. And I think it's that simple.
I'm curious if the numbers, if you have those, if that reflects, what some parents are doing. Are we seeing a number of kids getting vaccinated?
We are seeing quite a few kids getting vaccinated. So, and again, I think some people ride the fence and aren't sure what to do, and they want to wait until somebody else. And, right now that hasn't been a bad bet, but again, it comes down to probabilities. Is that at some point, what we're trying to do is decrease the probability of any individual having a bad case of COVID, but it's also the community not suddenly getting the surge again. Uh-huh. So it's been a good bet recently because we have such low transmission, but that's not going to last, gang. It's just not going to last, more than likely.
So people are watching this. They're like, hey, I got Christmas plans. I got some holiday vacation coming up. I'm going to, whether it's domestic or some maybe going international. Maybe they're going to France for the holidays. I mean, you can't tell someone to cancel a trip, but I mean, what do you think? I mean, what would you do?
So I heard some pretty good advice the other day, and I would certainly follow it. My family has a trip coming up, and what we're doing is watching. We're watching very carefully. We're watching our destination, which happens to be Colorado, and which did get hit a little bit with Delta surge again. Where we're going, it's not as bad. Interestingly, it's not as bad where we're going, but there are whole flocks of people getting vaccinated now. So because they know it's all around them in Colorado. We're just watching. We're being very, very cautious. We know that travel itself is pretty safe because of mask mandates, and it's pretty safe. My family is vaccinated. Everybody that's eligible is fully vaccinated. You just have to play it by ear, and you have to look at where you're going and what your immune status is. And in family gatherings, that's a tough one. I know that we just had a family gathering for Thanksgiving, and we all sort of self-declared whether we were vaccinated or not, and everybody was. And it made it a lot easier. We had it outside on the porch, so it was still people not social distancing. We had a great time, is that if we have a big surge happening again, especially if this thing is evading some of our immunity, that would be a game changer. We just have to see what it looks like. And it's a day by day, week by week thing.
And as news of the Omicron variant started to surface, more and more people started signing up to get their booster shot, and spots are filling up quickly. We have tons of information on where to get the booster and who's eligible right now on our website, clickorlando.com. I'm Justin Warmoth. Hope you have a great Sunday.